So this will be your McKenna moment.
No. I've had lots of moments.
No, but that's good. You're not behind the cage. You're just facing the protesters.
Sure.
Oh, by the way, they throw eggs. You want them? If I get hit, you want them well done or scrambled? Now you'll be all right.
Journal and say that we're going to cut 2,200 jobs from our province. What are we going to do? 2,200 jobs right there. That's a hell of a lot of jobs. Well, who did? It was in the Telegraph Journal last week, sir. It was there last week in the paper.
I didn't see it, ma'am.
Oh, come on now. You know you read the paper.
The Legislature proved once and for all that you were not consulted on the future of healthcare in New Brunswick when you wanted to play a role.
Did they know you, or?
What's that?
Did they know you?
We're working hard so we don't have to.
I'm friends with everyone on this family, and it kills me that most of my family are gone out west.
And that's why we're working to try to change right now.
I really don't want to go.
Certainly trying to maintain services, but really importantly, grow our economy,
If you
right?
continue to cut healthcare services, the health centers in rural New Brunswick, I will be forced to go to
What we're working is to be able to maintain. That's the
Well,
reality.
could you work a little harder?
Well, we are.
You know, like, my future is not looking good. My future is not looking good.
Side by side in 2004 and 2006 at the legislature.
We're working hard on it. Just like why we've been working, like even things like pension, where we've worked in a collaborative way, you know, to ensure that it's sustainable for the long term. And I appreciate that you guys have been working with us on it.
Yes,
and it's not easy.
How do you explain taking away so many workers and stuff like that, and even up short? I mean, some of us work in mental health facilities. I mean, we're not changing bed pans and after surgeries and stuff. I mean, yourself, you can get sick. Your parents are of the age that they'd be in the hospital, and we are left in the danger zone of overload. We're already overstressed as it is, and to lose any amount, we work short on a regular basis. I mean, you're supposed to have 12 people in one building, and you have 7. Like, that's crazy. And then the government, the upper guys, they keep getting more money, and we keep going down further and further. And it really, really is sad that the Canadian government is going so rotten on this.
What I can say as an example is the work that we're trying to do with these changes is to ensure that it's sustainable. We've started reducing the number we start with.
You have executive directors just spinning their chair around, doesn't do anything correct, right?
They're just changing positions.
All they did was change their title. They didn't. None of them went home. They get the same salary, and they just got a different title.
Those types of things I would love to know the specifics on. You know,
Just look at Horizon Health.
Because what
You're paying McGeary $350,000 a year to do what? I'm sorry, I just had open heart surgery last year, and if it wasn't for the healthcare system, I wouldn't be where I am today. And that's why we need to keep it the way it is right now. And if by you're trying to by cutting services, you're cutting frontline workers, you're cutting services. So we're not going to have that same kind of healthcare.
How do you justify the CEOs making more than the Prime Minister of Canada?
That's why we're doing our necessary work to make sure it is sustainable and better for the future.
Why do you keep keeping these people in the top positions and if you cut their jobs? You're cutting 7 or 8 people that do day-to-day work.
The future of our Canada.
Cuts to our health program.
Just don't listen to the public. You're not cutting in the right places. You're cutting all the wrong services. The jobs, the people that do the health work, that do the work on the floors, they're working short as it is now, and that's more services. The public are going to suffer from that. There's going to be longer waits for blood work, longer waits for x-rays, longer wait for surgery, longer wait for cancer treatments.
Actually, the work that we're doing, just as an example, the way we're making changes in the system, as an example, in electrocardiograms in St. John, people used to wait more than 20 weeks. Today, they're waiting 1 week. So the changes that we're doing is bringing forward things that will actually improve the system. You need to be an important part of that, and I fully believe that you will be part of that.
But you're saying St. John. What about the rest of the province? There's a lot of rural areas that are people in the rural areas feel like they're forgotten by this government.
The changes that we're trying to bring forward, as an example, primary care, will let people, no matter where they live in the province, have better access to primary care. You need to be a big part of that as well. So those are changes that are underway, and I have full confidence that when those changes are coming forward, people will have better access.
Why don't you ask the actual people that do the work?
We have been.
When? None of them have come to talk to any of us face to face. Not one.
That's right.
Look,
What about the
just
people that
as an example, we went through a consultation process right across the province. Okay.
Who did they talk to?
They talked to individuals like people were welcome to public meetings. Then all the different stakeholder groups were all part of it, including your groups. The primary healthcare renewal, your groups have very much been part of that process from square one.
They probably asked the guys that are being affected by it.
TV dinner.
Look,
how will she like it?
And my mom has needed health care, and she's received outstanding health care from you guys.
Yeah, because we're there for them.
You've got to stand here on your jacket. Take it off and we'll send it to St. John to get cleaned.
Okay.
Yeah, we're there for them. You're not for us. We're there for your mother and everybody else, but you're not for us. We're the people. We're there for sure. And people are tired, and it's about time you support us, the people that voted for somebody like you to be there.
And man,
Over.
for you.
You're lying. You're lying.
Listen. Oh, sorry. I got the camera on.
Oh, no, they do know that. No,
they knew he know that. We have a second?
Yeah.
Can we have a second?
Oh, no problem. Yeah.
Is this better than question period?
We should do it in the rotunda, though.
Oh, okay, sure.
Yeah, I mean, this could... Yeah.
I can't go there, so is this better than question period?
No.
People have the right as part of... people have the right as part of living in a democratic society to voice their concerns. So that's what they've done. I respect that.
I got to give you credit. As Premier, you went there. That's good.
Not the first time. It won't be the last time.
It's good. Thank you.
The cup gets going and you leave. That's the real Premier. Everybody needs health care. Remember, you'll be in the hospital one day.
Well, he went up front and he faced the protesters. I mean, you got to give him credit.